Good morning. We are Group 3 from BSMT1H and we will be discussing Niemann-Pick disease. So, this will be the flow of our discussion. First, the introduction will be discussed by both Mr. Rasty Meija and Kimberly Vasquez, which is me. Second, the clinical manifestations will be presented by Ms. Azel Chantengco, followed by other pertinent information about the disease. And lastly, the treatment will be discussed by Mr. Paolo Nebres.
People with lysosomal storage diseases have inherited deficiencies in one or more of their lysosomal enzymes, which affects their body's ability to degrade lipids. Niemann-Pick disease is an example of a lysosomal storage disease in which dangerous amounts of lipids build up in the spleen, liver, lungs, bone marrow, and brain. A deficiency of acid sphingomyelinase disrupts cholesterol breakdown or transportation. This enzyme is required for proper lipid metabolism, and its absence affects lipid metabolism and cause acid sphingomyelinase deficiency. Now, let's proceed to the types of NPD. First is type A. Type A is the most severe and is usually fatal for children below 3 years old who exhibit a cherry red spot. Type A is caused by mutations in the SMPD1 gene, which leads to impaired production of the acid sphingomyelinase enzyme. Type B is less severe than type A, but it is also caused by mutations in the SMPD1 gene. NPD type C has two subdivisions, NPDC1 and NPDC2. NPC1 gene mutations are responsible for type C1 and they occur in 95% of NPD type C cases. Homozygous mutations cause NPD type 2 in the NPC2 gene, appearing in over 5% of the cases. Lastly, type E is an uncommon variant of NPD. It usually develops during adulthood. However, research on it is limited. And inheritance. NPD gene mutations are passed down through autosomal recessive inheritance from parents to children. For the child to be affected, both the mother and father must pass on the defective form of the gene. In most cases, a child's parents are carriers if they harbor one copy of the altered gene but do not have the disease. If both parents are carriers, each pregnancy has a 25% chance of producing an affected child.
So, let's move on to the causes of the different types of Niemann-Pick disease. Mutations in the SMPD1 gene cause types A and B. This gene directs the production of an enzyme known as acid sphingomyelinase, which is responsible for converting sphingomyelin, a lipid, into ceramide, a different kind of lipid. So, mutations in the SMPD1 gene causes a shortage of acid sphingomyelinase, thus reducing sphingomyelin breakdown and increasing fat accumulation in cells. This impairs the function of the patient's tissues and organs such as the brain, lungs, spleen, and liver over time. Next, NPD type C is caused by mutations in the NPC1 or NPC2 genes. They are found in chromosomes 18 and 14 respectively. These genes make proteins that help lipids move around inside cells. So, mutation in these genes cause a lack of functional protein, thus preventing cholesterol and other lipids from moving and forcing them to accumulate in cells. The buildup of lipids, combined with cell dysfunction, leads to cell death and results in tissue and organ damage. Next, other names of NPD include lipid histiocytosis, neuronal cholesterol lipidosis, neuronal lipidosis, sphingomyelin lipidosis, cholesterol lipidosis, and sphingomyelinase deficiency.
Hello, I am Azel Chantengco and I will be discussing the clinical manifestations of the disease. Niemann-Pick disease has a wide variety of symptoms with varying degrees of severity. The symptoms of type A are the following. First, hepatosplenomegaly, which means enlarged liver and spleen and can be observed in patients within 3 to 6 months of age. Second, a cherry red spot can be observed in the eye, which indicates the presence of lipid degenerate in ganglion cells. Other symptoms include feeding difficulties, loss of appetite, and loss of early motor skills. Next, the symptoms of type B. These symptoms are similar to type A but are milder. It consists of neurological symptoms, delayed bone growth, abdominal distension, and thrombocytopenia, which means low platelet count. Lastly, the symptoms of type C includes dystonia, which is the continuous unintentional muscle contractions that can cause uncontrollable and repetitive movements. Patients also exhibit hepatosplenomegaly, jaundice, which occurs at birth or shortly after the birth, learning difficulties, and intellectual disabilities such as dementia. It also includes seizures, slurred or irregular speech, cataplexy or the sudden loss of muscle tone, tremors, vertical supranuclear gaze palsy, which means that they have trouble moving their eyes up and down, and ataxia, which may cause clumsiness or walking problems.
Hello again, my name is Kimberly Vasquez, and I will be discussing the other pertinent information about the disease, which includes its statistics, evaluation, and some differential diagnosis. So, the incidence of NPD associated with SMPD1 gene is estimated to be 1 in 250,000. A significant percentage of individuals affected were found to be of Ashkenazi Jewish descent. They were around Eastern and Central Europe. In addition, NPD type B most commonly affected people around the Maghreb region in Tunisian Morocco and Algeria of North Africa. On the other hand, the incidence of NPD type C was estimated to be 1 in 150,000, with frequent cases of French Acadian descent in Nova Scotia and Spanish American descent in New Mexico and Colorado. For the evaluation, leukocytes in the blood samples of patients suspected of having NPD type A or type B help determine their ASM activity or their acid sphingomyelinase activity and help determine if additional gene testing is required. On the other hand, a skin biopsy taken and stained with Philippine helps measure enzyme activity for patients suspected of NPD type C. In addition, DNA testing can be used to determine the genes that cause these NPD type C. When the disease has been confirmed, additional attention is given to the patient's different body systems. Let's proceed to the differential diagnosis. Niemann-Pick disease can be mistaken for other lysosomal storage diseases such as Gaucher disease, Tay-Sachs disease, and metachromatic leukodystrophy. Let's define each one. First, Gaucher disease is caused by a deficiency in the glucose cerebrosidase enzyme, which leads to glucose cerebroside accumulation instead of sphingomyelin, as was seen in NPD. However, unlike NPD, Gaucher disease has more prominent bone pains and lesions and is characterized by hepatosplenomegaly and cytopenias. Second, Tay-Sachs disease has the characteristic cherry red spot on the macula, neurodegeneration, and delayed growth. The enzyme deficient here is hexosaminidase A, which leads to GM2 gangliosides accumulation. Lastly, metachromatic leukodystrophy has similar neurological symptoms and ataxia as NPD and can cause central and peripheral demyelination.
Hello everyone, my name is Paolo Nebres, and now that we've generally discussed what are the causes, symptoms, and other pertinent information regarding the Niemann-Pick disease, let us now discuss what are the known medical interventions or treatment for this particular disease. So, as it is known, there are currently three main types of the Niemann-Pick disease, and unfortunately, there is no known cure. However, based on the type or form of the disease, there can be medical interventions and supplemental medications available that will improve the patient's quality of life. This means that there are different treatments for each type of NPD, and we will be tackling each and every one of them, starting with type A. Type A. Type A is known as the most severe form of the Niemann-Pick disease, as it is considered to be fatal within the few years of contracting the disease, as most patients have a life expectancy of only 18 months. And currently, there are no known effective treatments for this form of disease. For the next one, we have type B and its treatment. So, type B NPD is a milder form of the Niemann-Pick disease. The reason it is considered to be milder is most patients with it will normally live through their teenage years, unlike the former kind of NPD. And unlike type A, treatments are readily available for type B, such as enzyme replacement therapy. Senpozyme is an example of an enzyme replacement therapy rather, and is considered to be the first ASMD specific treatment or for the NPD type B. This was developed to reduce the accumulation of fat within the cells and relieve some of the specific symptoms of the disease by replacing the patient's defective enzyme called ASM or acid sphingomyelinase. Additionally, patients with chronic visceral types of ASMD or type B are predicted to have the most clinical benefit with Zenpozyme. Lastly, Zenpozyme can be administered intravenously every 2 weeks by diluting the powder into a solution for infusion. Next one, we have bone marrow transplant. So, bone marrow transplant was believed to be a helpful treatment for type B. However, in recent studies, it was deemed to be ineffective in terms of treating the neurological implications or the symptoms or neurological symptoms of the disease. Next one, we have patient monitoring. So, as I've established, or as we have established before, there is currently no cure for the Niemann-Pick disease, although treatment and constant monitoring may help the patient's quality of life. For example, constant monitoring of the liver function of patients that were initially prescribed with statin. You can see what statin is from our PowerPoint presentation, and the constant monitoring of the serum cholesterol concentration of the patients, especially adults, is clinically advised. However, it is also important to note that this does not relieve the patient's clinical symptoms. Lastly, we have type C, or most commonly known as NPC. This is a form of the Niemann-Pick disease which can be mild or fatal depending on the patient or the individual affected. Life expectancy may differ, but most can live through their late childhood up to adulthood. So treatments for NPC include miglustat, or otherwise known as Savesca. This is an enzyme inhibitor that acts by blocking or inhibiting the body from manufacturing fatty substances, resulting in less accumulation in the body, effectively decreasing related type symptoms. Additionally, a recent study shows that 92 NPC patients who took miglustat for 2 years displayed significant neurological improvement. And up until recently, actually, anti-epileptics and antidepressants were used as a treatment for NPD to alleviate some of the neurological conditions that the disease has brought about, such as tremors and seizures. However, miglustat replaced this practice as this drug was observed to be able to delay the neurological implications of certain diseases, such as the NPC and Gaucher disease. So another drug called an HPBCD was also believed to be able to aid in some of the clinical manifestations of the disease. However, due to the low number of data and clinical trials available or that were conducted, it was not yet considered to be an effective treatment. So, due to the fact that the Niemann-Pick disease is such a rare occurring disease, there are currently no known cure for it. But with the help of different medical interventions, treatments, primary care physicians, therapies, constant monitoring, and constant consultations from your personal physician, we can definitely reduce and manage the clinical symptoms or manifestations of said disease. And because of the rapid growth of our medical field and medical advancement and numerous efforts from individuals to research the Niemann-Pick disease, there is no reason to believe that there would be no cure for this disease in the near future. So I think that is it. That is it, guys. So I hope you have learned a lot from our discussion. Thank you very much, and see you again soon.